the quicker you can move, I guess, to how do we attack this and like, do we believe in this and how much do we believe in this and what are we going to do next? And you start deepening your resolve. And it's experiences like that that do actually, I think, make you more grounded in yourself, more resolute or determined to go on your mission. And honestly, like, I think we're in a better place now, having gone through that together.
Hello, and welcome to Season 3 of The Founder Mindset, brought to you by ATB. I'm your host, Leah and Sameer, and I'm delighted to be back for another season of talking to founders about what it's really like to build a company from that first big idea. If you've listened to previous episodes, you know I was a journalist for over 20 years, so I'm more curious about why anyone would ever want to become an entrepreneur. Not so much about the business model, product market fit, and so on. I want to understand why entrepreneurs keep going, why they think they're the ones to solve a massive problem, why they want to make a real impact in the world. And if you're here, I bet you want to know why too. Let's find out. Joining me today is Sameer Dhar, co-founder and CEO of Nia Health, a health tech startup built to prevent disease with at-home lab testing and expert guidance. Sameer, thanks so much for being here.
My pleasure. Thanks for having me on.
All right. So usually at the beginning of these conversations, I go right back to how you even became an entrepreneur. And in your case, Nia Health is actually your second venture. You started with Sensassure. Is that right?
Correct. Yep.
Cool. How did you even become an entrepreneur in the first place?
You know, my journey into entrepreneurship probably started towards the end of high school. I really got involved in student council and kind of taking leadership roles and positions, trying to make change happen. And in that context, it was a lot to do with poverty relief and charitable work. As a result of a pilot project I had started in high school in grade 12, I ended up co-founding a charitable organization that has ended up raising millions towards local poverty relief efforts across Alberta. And that was my first foray into starting something, trying to solve a problem, not for profit. My kind of arc as a entrepreneur has always been characterized by competing forces, if you will, of wanting to make a difference in the world and truly like make social change and do good. And at the same time, realizing the realities of the world where, you know, money and financial means is actually fairly important in terms of actually trying to make that change happen. It took the form during university of me actually thinking I needed to go the high finance route and become an investment banker. I realized I didn't want to be an investment banker while working in the industry at Morgan Stanley over one summer. And I would tell you that joining a program and getting admitted in a program called the Next 36, which you might be familiar with, was a life-changing moment for me because until then, even though I had started a charitable organization, had done something fairly entrepreneurial, I never thought that entrepreneurship was a viable path coming right out of post-secondary.
Why did you think that?
Yeah, I would say I'm a child of immigrants, so it is true what they say that success in immigrant land is looked at as being a doctor, engineer, lawyer, and academics are kind of the most paramount of importance thing that you needed to focus on as you're growing up. And so having kind of stability of career and job and whatnot, that was super important. And so that was, and my sister's, a surgeon and followed that track. So I didn't necessarily in the immediate family have a path where you didn't take that less chosen path. And so, yeah, like Next 36 opened up my eyes to, hey, entrepreneurship can actually be something you get into immediately, and that you don't have to be an expert or have a fully developed skill set and understanding of a space in order to solve problems and build a business in it. And yeah, my journey with Sensassure basically started with the Next 36 and saying, hey, I want to solve a problem that makes a difference in people's lives and maybe make a business out of that. And so elder tech and elder care was a relatively unserved market and still is, although there's much more hype around it these days, it seems. But 10 years ago, that was where I started. And I went and I talked to a ton of different stakeholders in the space, geriatricians, care home administrators, nursing staff, and said, hey, where does your day suck? And funny enough, they were the ones that elucidated this idea of incontinence to me because I didn't even know
Yeah,
what that meant. I didn't even know
right.
what that meant, right? At 20, 21 years old.
Why
So,
would you? Yeah. And so you solved this problem.
yeah, I mean, it was a case study of, hey, go to an underserved market, understand the pain points, and then go as deep as humanly possible on the pain point, and then see if there's a marriage of technology and other things could help solve the problem.
And it did. Did you not, though, like when you were doing this discovery, live in the nursing home for a while?
Yeah, no, actually, that was during the course of the Sensassure journey. The team and I, we lived out of three different nursing homes across North America for 12 months. So two in the US, one in Ontario.
For 12 months, like a year?
Yeah,
That is a
absolutely.
long time to be like in your 20s living in a nursing home.
Yeah, no, that's right. That's right. But it was incredible. It was an incredible experience, not just from business perspective in terms of getting to know your users intimately and developing empathy and all that good stuff, but also as from a life perspective. I think personally, it's bonded me. It further entrenched my love of older people and my belief actually that multi-generational living is and should be the way of the future. And so, yeah, anyway, there's a lot of wanderings I had around that whole idea.
There's a lot to learn from these people for sure. So you went ahead and came up with this company and solved this problem. And this company was acquired back in 2016. Is that right?
Correct. Yeah. Towards the end of 2016.
Wow. But I can't help but reflect on the fact that you also sort of skirted over this issue, but that you also started a charity that's raised millions, and now you've get Sensassure, and it's solving this massive problem for seniors that really improves their quality of life. This is a huge deal, and we haven't even gotten to Nia Health yet. Like, that's incredible. How do you feel about that?
I feel good about, having spent time working on problems that I think are worthy. And I think I was lucky enough relatively early on in life, as I described earlier, to be able to get the feeling that you get when you make a difference in someone else's life. And often, in the charitable context, you don't get anything back in return. And even from a charity perspective, I think motivating the heart of a volunteer, it's much harder to do that than it is hire somebody for a paycheck, right? But the beauty and magic, I think, comes when you have a mission that is social in nature, but someone can also get that paycheck. So you can create a truly remarkable team that's mission aligned and driven, no matter what enterprise you're going after, if that mission is true.
I love that. And we'll dig into that a bit more because I'm very interested in this mission and culture business. I love that. But let's get to Nia Health. So tell me just a little bit about what it is.
Yeah, so Nia Health is Canada's first end-to-end proactive health platform that leverages advanced diagnostics such as advanced blood work, VO2 max, DEXA scans, gut microbiome testing, continuous glucose monitoring, you name it, the most evidence-based stuff compiled and accessibly priced in one place. We also have clinician interpretation of the results and consultation with licensed clinicians across the country. Yeah, I mean, we're doing a lot of cool stuff in the platform these days around integrating wearables and other streams of data that right now have not in the public system context been put together in that one cohesive picture. So you get a truly comprehensive view of your risks to health and longevity, and we're really striving to be that partner that stays with you through life on your health journey.
That's amazing. How does it actually work? Like, it's a subscription model, I understand?
Yeah, on the consumer side, we have a annual subscription models, three different packages, starting at $299. So we're the most accessibly priced platform of its kind in the country. You sign up, and all our assessments start based on blood. We'll send a phlebotomist to your house or office, or if you're in Manitoba or Ontario, you can go into a clinic, and we'll take your blood in just a couple minutes. We'll take your full medical history, and between that medical history plus your point in time set of blood work, we'll say, hey, here's your biggest risks to health span longevity. Here's the most actionable set of things you can do to get in front of that risk. And we're screening across the board for up to 160 biomarkers. So a far more comprehensive view than most people and most Canadians would have access to otherwise.
Wow, that's incredible. And so then is the goal that people have the information they need to take action and live healthier lives, I would imagine.
Absolutely. And we are continuing to build feature set towards being a partner. So in between checkups, you're not just coming to us once or twice a year to check on these different markers. You're also seeing us as that coach, that champion, that partner, that friend in your pocket that's going to be there for you to help guide your behavior change and make sure that the action plans that we set out at those intervals are actually followed through on and that your risk indeed does decline over time.
That's amazing. Talk about impact. So help me understand how you're thinking about it in terms of how it works with the public healthcare system in Canada.
So right now, the public healthcare system, and it's not just in Canada, but globally, public health systems were really designed to treat disease after the fact. I mean, a lot is talked about reactive versus preventative or proactive medicine. And so, yeah, that's what the public system's set up. It'll tell you, it does a pretty good job of telling you after you already have disease and then how you can, take action to treat it. But it, for various reasons, is not necessarily set up to provide best in class proactive health or preventative medicine at scale. I mean, different public authorities are trying to raise the importance of prevention, but it's hard to implement at scale. And so our vision is we want to do the things that are challenging for the public system to do, but be complementary in that sense. So we're not looking to replace in any way primary care. And actually, we've designed our product and our solution to work quite well with primary care. So if you get risks flagged through our solution, everybody gets a letter to their primary care provider that's based on Canadian guidelines for any recommended follow-up next steps. You could take that in, and we found a lot of success with people getting the next steps they need through the public system with that. And then our clinician consults, again, we're dealing with licensed nurse practitioners across the country who are well equipped to help provide that transitional piece to primary care as necessary. By taking this approach from the ground up and looking at ourselves as a responsible complementary actor in this public system, we're seeing success. We're seeing success.
And to be clear, this is not executive health. You already mentioned your entry level subscription. It's very sort of approachable for a lot of people. But tell me how you're thinking about that too.
We never came into this market to say, hey, we want to develop something that just competes against executive health, because our goal is to get our solution to millions, if not more people. And every Canadian in our dream world should have access to this type of care. So that necessarily means that you have to do everything possible to bring price point down to something that's accessible to the masses. And honestly, even at $299, we know we're not there yet, but we are the most accessibly priced provider in the country. We're going to keep pushing forward on getting price point down and other payers involved to increase our utility to a broader set of people. But on the exec health side of the house, it's been interesting because we have also realized that we can compete directly against executive health as our solution has grown in terms of the diagnostics we offer and our evidence-based approach with a preventative lens. And actually, a number of major accounting firms and law firms across the country are now offering our solution. Now, this would be the higher end, more comprehensive packages that can go up to $14.99 per year, but include, a bunch of other diagnostics like VO2, DEXA, gut microbiome, multiple blood draws per year, et cetera. But we're basically being put right up against other executive health providers for partners to choose from as part of their annual executive health entitlement. So it's been interesting to see when you start building from first principles, you can create something magical that has a lot of application across verticals.
Absolutely. Tell me a little bit, just some basics about the company. How many employees have you got right now?
Actually, that's a good question. We're growing pretty quickly these days, but we're around 13 full-time employees right now.
Yeah, incredible. And how many clients do you have?
In the thousands.
Wow.
I don't actually know what the latest count is, but we've been growing 25 to 30% month over month. And keep in mind, we've only been around for 18 months, of which the first 8 or 9 months were focused wholly on building a best-in-class product experience and not much on growth. So we've been for less than a year focused on growth. Yet we also have over 15,000 people across the country on our wait list. And so we're seeing this desire on the part of Canadians to get access to proactive health solutions and want to take control of their health.
Yeah, no kidding. Do you want to talk a little bit about the money that you've raised thus far?
We're super fortunate within this 18-month period to have raised over $8 million between our pre-seed and seed round. We just closed our seed round a few weeks ago. We're super excited to have some of the top seed and early stage firms in the country backing us, including Version 1 Ventures and Golden Ventures, and then a host of other funds across the country and angel investors. So it's been a remarkable journey that way. And actually, we were preempted on both financing rounds. So I think the interest, even on the investor side of the house these days, for proactive health and solutions around preventative medicine has been very encouraging.
That's so exciting. Congratulations.
The Founder Mindset is brought to you by ATB Financial. In the fast-paced world of tech, your banking needs evolve as quickly as your industry. Whether you're just starting out or aiming to reach new heights, ATB Financial is dedicated to supporting tech companies every step of the way. Partner with ATB Financial for a banking solution that grows with your business.
As we all know, in the growth of these high-tech companies, something always goes sideways. There's always things to fix and solve. So maybe just take a moment to reflect on, I ask everybody in the chair this question, a do or die moment in the growth of your company when you just didn't know how things were going to go and how you were going to move through it. Have you got a story that comes to mind?
Yeah, absolutely. And actually, it's so funny because I think this similar type story happened in Sensassure days, so my first company, where basically after having taken money from people and from investors that you really respect, it lost a very key co-founder. Co-founder just decided that it was not the right fit for them at this point in life. And I think that's one of the risks when you partner with people who have not been through the startup journey before. Intellectually, you can kind of understand how hard it's going to be and what the sacrifices that need to be made are, but you don't really understand until you're in it. And so I give no fault to anybody who takes the leap and then understands after the fact that it wasn't necessarily the right path for them. They were such a pivotal member because they were actually one of the clinicians. They were the clinician on the founding team, and you're stuck building a a company that's heavily based on needing that clinician to even deliver the service. Forget about designing the whole solution, et cetera. And you gotta just figure it out. And that happened to me in Sensassure too, by the way. Like I remember at one point we were building a medical device. Every potential co-founder that I was working with, including the technical leads, everybody had decided they need to go a different way. And so it was just Sameer kind of hanging out, trying to figure out how to build a medical device as a non-technical person who'd never done anything in the medical field before. So yeah, these types of things, I think I don't know if it's normalized across the board, but for sure for me, when your back's up against the wall, really figure out how committed you are to something and what you're, willing to do to overcome it, I think is a character building exercise every time.
No kidding, it is every single time. I'm so curious though about like how that actually felt when your co-founder said this to you. He's like, or he or she, I'm out. Like I can't do it. What did that feel like in that moment for you?
And initially, I would say it's a lot of anxiety and fear. You really wholly feel the weight of, the expectations that you've set for yourself and that you've committed other investors and whatnot. And I mean, I think it's like it's a moment where I called, the other co-founder that didn't quit. um, and it was funny enough because he was on his honeymoon.
Oh, of
I was
course.
trying to make sure that he had some quality time with his spouse while he was in New Zealand. But I said, I think this type of situation warrants a 911 call here, and so and I think through leaning on each other, we deepened our resolve. I think that's the key always is the fear and kind of like despair almost of what are you going to do and how tragic the potential consequences are is it's a very natural first instinct. The quicker you can move, I guess, to how do we attack this and like, do we believe in this and how much do we believe in this and what are we going to do next? And you start deepening your resolve. And it's experiences like that that do actually, I think, make you more grounded in yourself, more resolute or determined to go on your mission. And honestly, like I think we're in a better place now, having gone through that together,
For
right?
sure.
So, yeah.
But like, I mean, I'm sorry to keep it, but it's like, how do you actually get there? Like, I mean, I can see you like getting that phone call. You've just taken all this money. And I mean, yes, the anxiety and the fear, but then how do you make that shift to the, okay, let's just start actioning this. Let's just start figuring this out. Do you take time to freak out?
No, I don't. I mean, I know people do, but you're going to have a billion different situations that are going to put your whole commitment into question and whatnot. And I think there's no time to me, there's no time to hold that fear and despair. It's all about action. And yeah, so like I'm talking like an hour or two to get back
An
on the
hour
horse.
or
And
two?
yeah, 100%.
Wow.
You can't kind of sit on these things. The only way to get out of these types of situations is to keep moving forward, right? So I mean, if you get bogged down with despair and fear, I mean, it's paralyzing. So I think, the quicker you can move towards, or the quicker I was able to like move towards the next right step. So it's like, okay, now how do we talk to 100 potential clinicians to figure this thing out? Like, I mean, it's that becomes empowering and kind of gets you out of any rut.
For sure it does. How has moving through that experience sort of changed how you continue to build?
Interestingly enough, it opened up the space to move away from a physician-based operating model to a nurse practitioner driven operating model. So if that situation had not happened, I don't know that we would have made that switch. We still love our physicians and are able to, collaborate and get the benefit of many aspects of their different specialties, et cetera. But I've been super excited about the impact that nurse practitioners have been able to make as preventative health practitioners and coaches and kind of companions, if you will, along their journeys, the health journeys of our clients. So I consider myself super fortunate to have gone through that experience because I think we wouldn't have made this shift otherwise, probably.
No kidding. That's incredible. Okay, so we've talked about like how intense and scary and anxiety inducing being an entrepreneur can be, but how wonderful is it as well? I mean, there's a reason you keep going back. I mean, this isn't your first journey, right? So why do you keep going back to this kind of work?
There's a couple things. So one is just like a freedom to pursue your own path and to pursue your own curiosities and have a project of one's own and to pull on a thread that you genuinely just personally find interesting, right? I think once you've tasted that, when you wake up every morning and no one's really telling you what to do, right? I mean, you every day have to make your own opportunity. You have to, execute on your own ideas and your own vision in collaboration, of course, with the rest of the team and other people in the business. But once you've tasted that way of living, I liken it to being in the jungle. Whereas I think a lot of the population's in the zoo.
Okay, I like that.
I'd rather be in the jungle than in the zoo is the way that I kind of frame it. Once you've tasted that, it's really hard to go back. It's really hard to go back to a different way of being and living. And honestly, I can say that with some experience behind it because I spent about 4 years in between businesses trying to find the second business or trying to find out what I wanted to do next with my life. Regardless of what I tried, just kept returning back to wanting to, again, build something and create something that made a difference in people's lives. So maybe it's a bug that if you catch it, it's hard to let go of.
It's hard to shake. No kidding. I love it. But as we know, being an entrepreneur is like not a 9 to 5 job. It's very risky. It's super intense. How does that actually affect your personal life, if you don't mind me asking?
Yeah, that's a really good question. And let's just say this. I was single during Sensassure and I'm single now during Nia. So it is very challenging because it takes a lot out of you, right? Like you're working. I mean, I'm probably on a baseline. You're averaging on a good week 60 hours, and it's not about the hours. It's not necessarily like I'm punching the time clock thinking about how many hours you're working, but you're just doing it because you want to, right? And it takes a lot out of you. So by the end of the day, you come back home and You sometimes ask yourself, like, man, like I don't even have the energy to go on a date right now. But I do know that this is also characteristic of the phase of the business that we're in. When you're in the first couple of years, it's a real grind, right? Like you just have to. It's a Herculean effort to create something from nothing. And a lot of that energy and the effort, where's the source of it? It's the founders, right? One of my co-founders, Mike, like he just had a baby earlier this year. In many ways, I mean, it's like it's work, his marriage and the baby. Like that's all you have time for if you're kind of like starting something the first couple of years and also have those types of personal commitments. So yeah, I mean, it's that's a very long-winded way of saying that. I mean, on the personal front, I would say that I do prioritize my relationships. It's actually the number one. It's the number one kind of thing about Sameer, if you will. It's my friends, family, etc. I'm still able to make time, to go on trips, etc. with folks, but it's different, right? Like when you're on those trips, you're still always. It feels like you're always on, right? You can't completely disconnect at this stage of the business, I find. Although I'm sure there's a bunch of executive coaches and whatnot that'll say how that's counterproductive and it's not. But I don't know. To be honest, that wisdom aside, because I do meditate, journal, have some practices to help ground yourself and all that. But this founder energy at the beginning to just be there, be available. I concierge the first couple thousand customers, their experiences, just because you want to be so close to your customer and user. It takes that type of commitment, I think.
Yeah. Do you give any thought to, well, I mean, you sort of mentioned it, if you do a little bit of meditation and maybe some journaling, but do you give any thought to how do I sort of fill up my own battery so I can keep going?
Yeah, it's an ongoing struggle. I would say to you, like, I've never personally, quote unquote, burnt out. When you're pushing this hard, it's inevitable that you get closer to times where you might be, getting on into the danger zone. And I think I've developed the awareness of some of those tells. Like I start to get much more cranky. I'm losing my cool more. I think there's this unproductive anxiety slash impatience that then has an impact on others on the team. It's in those types of moments that maybe you take a step back and you say, hey, you know what, I do need to just go on a super long bike ride or just not think about work for a day or whatever the thing is and disconnect. So, and as I observe, because this is a topic that we talk about on the team as well, especially given the fact that we're championing proactive health.
Right.
It's one that each person, I think, at least our culture right now, is each person ends up finding their own equilibrium, if you will. And so I think the key is communication of, hey, I'm getting in the danger zone. Need your support to kind of, take X time off or do whatever. And here's how we can, support each other in terms of being able to be on the journey over the long term together.
That's impressive that you've got the awareness, number one, but then the ability to communicate those needs with your team. That's very impressive.
Yeah, I mean, I wouldn't say we're perfect at it by any means, but having the awareness and wanting to create a culture and environment of psychological safety where people can actually talk about how they're faring. Like we have this, weekly sync. One of the key things that I think is important is understanding yellow, red, green up front. How are people feeling overall? Just could be personal, professional, whatever, and understanding where people are in their journeys, both personally and professionally, allows you to meet them where they are too. So yeah, communication, transparency, and support, I think.
So you've clearly given that thought and have prioritized that and made that a real thing in the sense that it's not like something you just kind of talk about and don't do it. You know what I mean? You actually have prioritized. If there's an actual meeting where you discuss this, that's important.
Yeah. And I mean, one of the privileges, it's funny, like our clinical director, like one of my co-founders, she does a great job of, hey, if somebody's getting into the danger zone, helping to put an action plan in place for them, checking in, helping to create the environment on the team, as well as just like one-to-one kind of as a practitioner to support our team. So that's like, we're trying to leverage some of the principles as well of what we're trying to do from a proactive health perspective to help people on the team when we do get to that danger zone.
Yeah, that's great. That's amazing. And of course, one of the things that keeps people moving forward, even when things get tough, is this notion of impact. Impact is really important to us here at Thin Air Labs, but I also wanted to talk to you about that. How do you think about creating sort of meaningful human impact in the world?
I love that matrix or chart of on the x-axis, you have the number of people impacted, right? And on the y-axis, it's potentially the impact per person that you can create. So you can imagine two extremes. Let's just say one where you have a medical device that's directly saving people's lives, but it might save 1,000 people's lives, but it saves their life, right? So that the number of people impacted might be low, but the impact per person is pretty extreme. Whereas you might look at I don't know, Facebook, let's just say, or Meta, where it's billions of people and maybe much lower impact per person. And I think the way that I look at it is the area under the curve could end up being the same, regardless of the number of people impacted, depending on the level of impact. So I think that's just one philosophical way that I've always thought about impact and what to work on. But I think the other is much more subjective because it's tied to every founder's and every person's own perception of meaning and what is considered to be meaningful. And that's been a driving force behind what I will and will not be willing to commit to. And it's a good kind of like back check, if you will, as you're running with an idea. If you haven't started a company before and you're trying some sort of experiments around some concept that you have. I mean, you find out pretty quickly if it's meaningful enough personally to you to devote your life towards. Right? You can't discount just your own intuition on what each individual person feels is meaningful.
Yeah. And then, carrying this thought through, if you're thinking of impact, how does that sort of directly line up with what you're doing at Nia Health?
Yeah. So to me, Nia Health could, if successful, change as a starting point how the healthcare system in Canada works. So imagine a world where millions, tens of millions, maybe every Canadian is using Nia as their center point of their health journey. And before they're ill or before they're sick, all throughout their life, they are understanding their metrics in a way that is common in business, but not when it comes to our own personal health, right? Like if you
Right.
go to a business owner and you say, hey, all you need to worry about is increasing revenues and decreasing expenses. You don't worry about your operating metrics. I think they tell you you're crazy, right? But when it comes to our health, people say, well, I don't need to know my metrics, because I just know I need to eat better and sleep more and exercise, right? But I think I imagine a world where people own their health from a very young age, all throughout life, and are empowered over their health journeys in a way that the system's currently not set up to facilitate. I think then what you do is you create health outcomes over time that require less and less use of public resources and less disease and better health spans and happier and more fulfilled and joyful populations as a whole. That is a future worth fighting for. Like win or lose, it's a worthy cause. Like I can wake up every morning and say that that's worth fighting for. So that's how I look at impact within the context of Nia. And that's why, as I alluded to earlier, we're very, very conscious of price point. How do we bring it to even more people? How do we bring other payers like insurers? And I think eventually government should be paying for this, especially given we're the most efficient provider of prevention in the country already. So eventually, when we can prove enough of our outcomes, other payers should come in, and that's how we'll change the world. So anyway, that's kind of how I see it.
I love it. I love it. I love how you think about this. And it lines up perfectly with our final two questions here. So you're the co-founder of Nia. How do you hope the story goes for Nia?
I will be satisfied if our impact is on millions of people. But I think that my stretch moonshot goal is that this is something global and that billions of people end up benefiting from this movement. I actually have no doubt this movement, broadly speaking, towards prevention and proactive health is going to be impactful in the billions, in the order of magnitude of billions over time. But I'd love to see Nia being a catalytic force behind making that happen. I truly mean that. Like I wake up every morning, with that as my North Star. And then, yeah, like, to me, starting with Canada first, I'd love for everybody to have access to Nia in a way that's that they feel good about, and they're not feeling stretched wallet wise to be spending on Nia, or that it's already covered by other actors in the system. To me, getting this out to millions of Canadians and every Canadian knowing what Nia is, like, that'd be a great starting point. How's that?
I love it. That's amazing. Okay, and you're the co-founder of Nia. So how do you hope your personal story as a founder goes?
A big differentiator in terms of our story versus even other competitors in the space is we have been very rooted in trying to be evidence-based, in trying to understand what the public system does and doesn't do, and how we can fit responsibly within the constraints of some of the things in the Canadian health system, to be a responsible actor and evidence-based in this world where we have a lot of hype. We got a lot of thought leaders. We got a lot of celebrities in down south who are kind of backing a bunch of companies. To me, I would hope that at the end of this journey, I'd be able to look back and know that we continued to build with integrity. We're able to tell that story in a way that got people excited, in a similar way to where we're seeing the hype being built around celebs and celebrity physicians, for example, and things like that. I'd like to know that as a founder, I didn't get caught up in hype, and that I always remained grounded and rooted in principle and doing the right thing for clients, and being hella focused on driving health outcomes. That'd be a great thing to be able to look back on.
I love it. Sameer, thank you for this conversation.
Thank you. I really appreciate being here.
If you're building a tech company in Canada, you've probably heard of Artemis. They're the recruiters founders trust to find the leaders and key teammates who'll shape the future of their business. I know them personally. They're thoughtful, genuinely caring, and deeply connected in tech. The Artemis Canada team treats every search like the future depends on it, because it does. Life sciences, aerospace, agribusiness, tech. The Opportunity Calgary Investment Fund is fueling Calgary's future through smart investment in innovative sectors and world-class talent. It's how we grow a resilient, diversified economy. Explore more at opportunitycalgary.com. API is helping innovators accelerate from idea to impact. Whether it's pharmaceuticals, medical devices and diagnostics, health technologies, or natural health products, API supports the full journey, from early research to clinical and commercial manufacturing. API bridges the gap between academia and industry right here in Canada.